Did you know that over 70% of women only discover breast cancer when it has already reached an advanced stage, when the chances of being cured are much lower? I'm Olivia Parker, and this truth always weighs heavily on me. The scariest part is that most of them once ignored minimal changes in their bodies, a tiny dimple on the skin, a slight difference in the nipple, or a small hard lump under the breast. Would you be sharp enough to notice if just one small change could save your life or a loved one's life? Breast cancer doesn't shout. It creeps in silently, like a thief in the night. Many women think it's just fatigue, hormonal imbalance, or a skin allergy until they hear the devastating news from their doctor. According to Harvard Health Research, women who perform monthly self-exams and get regular screenings are 2 to 3 times more likely to detect cancer early. That means their chances of survival are almost absolute. In this video, I'll share with you 7 silent signs of breast cancer that are often overlooked. Watch until the end, because even one small detail could save your life or someone you love. Breast cancer is the most common cancer in women, yet it often develops in silence. What worries me most is that many only discover it at a late stage, when treatment becomes far more difficult. According to the U.S. National Cancer Institute, the 5-year survival rate can exceed 90% if detected early. I once met a 45-year-old woman in California who believed the small lump in her breast was just a blocked milk duct. Fortunately, during a routine checkup, her doctor caught it in time. Because of that, she was treated successfully and now lives a healthy, happy life with her family. For me, every screening is more than just a medical test. It's a chance to preserve precious years of life, filled with health, love, and togetherness. One sign that's often overlooked but significant is a change in the shape or size of the breast. Usually, a woman's breasts may differ slightly, and that's completely natural. However, when the difference becomes more pronounced, appears suddenly, or when one breast shows unusual swelling, it could be your body's warning signal. Sometimes these changes are very subtle. One breast feels firmer, the volume is no longer balanced, or the shape looks different when wearing clothes. Many women assume it's just due to weight gain, hormonal shifts, or the menstrual cycle, but in reality, it could be an early sign of breast cancer. Staying alert to even the most minor changes gives you the best chance to detect the disease early, when treatment is still simple, effective, and can protect your health and future. One of the most easily overlooked signs is a change in the nipple. Typically, nipples maintain their shape over time, but when they suddenly become inverted, pulled inward, or begin to discharge fluid, mainly if it contains blood, this is an abnormal sign that demands attention. What makes it even more concerning is that these changes usually don't cause pain, leading many women to dismiss them. They often assume it's just hormones, aging, or after effects of childbirth. This could be one of the body's earliest warning signals. In medicine, there have been many cases where breast cancer was first detected through a slight change in the nipple, even before any lump appeared. That's why a professional must check every change, no matter how minor. Listening to your body and observing even the most minor details can sometimes be the most effective way to protect yourself. One of the classic signs of breast cancer is the appearance of a lump or abnormal mass. Typically, when a lump reaches about 1 to 2 centimeters in size, it can be felt, depending on whether it lies just under the skin or deeper inside. What makes these suspicious lumps different is that they are usually firm, less movable, and often painless. This is also why many women underestimate them. Small lumps rarely cause discomfort. They are often discovered accidentally while showering, changing bras, or during a routine health check. Not all breast lumps are cancerous. Many are benign. However, dismissing them and reassuring yourself with, "It's probably nothing," can cause you to miss the golden window for early treatment. Paying attention to your body and getting checked promptly remains one of the simplest, yet most powerful ways to protect yourself. Another sign that's often mistaken for a simple skin condition is a change in the skin of the breast. Pay close attention if you notice dimpling, enlarged pores, a rough texture resembling an orange peel, or areas of redness, flaking, and persistent inflammation. This isn't always just an allergy or reaction to skincare products. It can sometimes be an early warning sign of breast cancer. The danger lies in how easily these symptoms are dismissed. Many women assume it's only dermatitis or a mild reaction to the weather and delay seeking medical advice. Yet, in clinical practice, there have been numerous cases where breast cancer was diagnosed from what seemed like harmless surface changes. By staying alert to even the most minor skin changes on your breasts, you allow yourself to detect abnormalities early and protect your health in the most effective way possible. Another sign that can easily be mistaken for something else is pain or discomfort in the breast or armpit area. Many women assume it's related to their menstrual cycle, hormonal changes, or a muscle strain. In reality, persistent dull pain or occasional sharp stabs with no apparent cause may be linked to breast cancer. The real danger here is complacency. Many women wait for the pain to disappear on its own and only visit a doctor after months of discomfort. In some cases, pain in the armpit occurs because of reactive lymph nodes, an indication that a tumor may grow or even spread. Learning to distinguish between normal pain and unusual, unexplained pain is key. And when there's doubt, timely medical evaluation not only brings peace of mind, but could also open the door to early detection and life-saving treatment. Another often overlooked sign is swelling of the lymph nodes in the armpit or neck. Usually, lymph nodes act like the body's checkpoints, filtering out bacteria and waste. But when you can feel a firm, painless node that lingers for weeks in the armpit or neck, it could indicate that breast cancer cells have begun to spread. Sadly, many women don't associate swollen lymph nodes with breast cancer. They assume it's a minor infection or the body's reaction after a cold or flu. Yet in medicine, abnormal lymph nodes are one of the key signals doctors use to detect early metastasis. Not all enlarged nodes are dangerous, but persistent swelling deserves medical attention. Being proactive with checkups helps distinguish between a normal immune response and a potentially serious condition, ensuring timely treatment and better protection for your health. Another change that is often underestimated but highly significant is a transformation in the areola. Usually, the color and size of the areola remain relatively stable. However, this may be an essential warning sign when it suddenly becomes darker, larger, develops scaling, or shows persistent dry patches. Many women assume these shifts are hormonal changes, skin reactions to cosmetics, or a natural part of aging. Unfortunately, this assumption causes many to miss the chance for early detection of breast cancer. In fact, doctors have documented numerous cases where the first symptom was nothing more than a change in areola color or unusual long-lasting flaking skin. Carefully observing even the most minor changes around the areola could help you identify abnormalities very early, when treatment is still straightforward, effective, and potentially life-saving. Breast cancer is one of the most dangerous diseases for women, but the fortunate truth is that it can be managed if detected early. The 7 signs I've just shared, from changes in breast shape, lumps, nipple abnormalities, to swollen lymph nodes, are all signals your body may be sending. The question is, are we attentive enough to notice them and take timely action? According to the National Cancer Institute, the 5-year survival rate for breast cancer patients diagnosed at an early stage can exceed 90%. That number isn't just dry statistics. It's living proof of the power of regular screenings and paying attention to the most minor changes. I'm Olivia Parker, and here's my message. Listen to your body and never ignore suspicious signs. If you notice any unusual changes, See your doctor right away. A timely decision today could be what protects your life tomorrow. And if you found this video helpful, don't forget to like, subscribe, and turn on the notification bell so you won't miss the critical health knowledge I'll share in upcoming videos. Your support is my greatest motivation to continue bringing valuable content.